Sehr geehrte Damen und Herren,
Hello, I am Dr. Till Steinmeier.
ich möchte Ihnen heute
Today I would like to tell you about a very interesting case of a patient who has been suffering from chronic fatigue syndrome since 2005 and who developed a corona infection in March 2020.
eine Corona-Infektion entwickelte. Diese Patientin wurde behandelt.
This patient was treated with Inuspheresis and with an additional complementary therapy procedure. She improved clinically quite significantly. She then had a corona vaccination, which resulted in a return to the full clinical picture of ME CFS, or chronic fatigue syndrome.
At the age of 36, my life has completely changed. I was previously healthy, worked, was very happy in my life, did a lot of sports, ran, cross-country, mountain running, also marathons, and then a time started when I felt bad, had more headaches, had back pain, got lymph node swelling, and such a strange, short coughing. It then took 3 years with many visits to the doctor to find out that I had an immunological lung disease called sarcoidosis. This disease had to be treated with high doses of cortisone at first and then gradually over a long period of time. Under the long-term cortisone therapy, which I hadn't considered before that it could be related to this, I also developed a massive susceptibility to infections. So I got one infection after another. I had 2 small children at home with school and kindergarten, and I caught every infection that the children brought home with them, and I didn't get better at all. I also had lip herpes about 7 to 8 times a year, and every time after such an infection, the next one was already waiting. But I also had very severe headaches after the infections for a long time, for many months, which also made me go to many doctors because they were really almost unbearable. In addition, a very strong fatigue, exhaustion, muscle pain, and completely new symptoms developed in almost every organ of my body. I didn't know this before, so I got over it and thought, oh well, if I do enough exercise, it will get better for sure. But even after only a 10 kilometers run, I noticed that I didn't recover at all. About 2 days after such a run, I felt really sick even without an infection, had muscle pain, bone pain, tendon insertion pain, fatigue, exhaustion, and again the feeling that now the next infection is coming. I had sore muscles, which I had never experienced before. What I also noticed was that I could no longer bend over. When I got up, when I straightened up, I felt dizzy. So I bought compression stockings, which made it a little better. But in the end, over the course of 3 to 4 years, even with the cortisone, the lung disease improved, but I became ill in other ways. And then a real marathon of doctors began. I went from one doctor to another because I had symptoms on the bladder, these headaches, the infections. I went to physical treatment, physiotherapy. So everything that medicine offers, I tried to get better. But the exhaustion only increased over the years, until I couldn't get out of bed in the morning anymore. And it was very difficult for me to walk up the stairs to our apartment. I used to rush up them and then go for another 20 kilometers run. That didn't work at all anymore. So my life was a completely new one, a sick one.
ME CFS, in full words, distinctly myalgic encephalitis or chronic fatigue syndrome, is still not really clarified on the basis of evidence. But we do know a few things about it. First of all, we know that these patients often develop autoantibodies against G protein-coupled receptors. These mediate signals from the nervous system into the cell interior.
Zweitens,
Second, there is a disbalance, an imbalance between the sympathetic and parasympathetic nervous systems.
Parasympathikus. Und drittens,
And thirdly, it is almost always a mitochondriopathy. In other words, the mitochondria, the power plants of the cells, are disturbed in their function. So, the carbohydrates and fats that we burn as energy carriers to ATP, which happens in the mitochondria, this process no longer functions properly.
This condition, you almost won't believe me, but this condition lasted until about 2016, 2017. We then also noticed again and again that I had very high virus titers, herpes simplex virus, cytomegalovirus, which were always massively elevated. Each infection had then also led to a reactivation of these cerebral viruses, obviously, but no one could really do anything with it until my one doctor said, "You have something really bad. I just don't know what it is yet." All the doctors said I had depression. So everybody said, "You have to go to psychosomatic medicine." I was hospitalized about 7 times in different clinics, in internal medicine, in naturopathy, in the psychosomatic clinic. I also did outpatient psychotherapy to just cope better with it all, but nothing changed at all in the symptoms. Until I found a medical doctor who does automolecular medicine.
The patient's laboratory chemistry showed considerable deficiencies in minerals, in trace elements, deficiencies in amino acids, and even in absolutely necessary fatty acids. The patient also had significantly elevated inflammatory parameters, also autoantibodies, also a very clear Th2 shift that describes a tendency to a permanent inflammation, and also reactivated viruses, especially from the herpes group, that is, the herpes simplex virus and cytomegalovirus.
Furthermore, there were other things that I noticed that got much worse. I had already developed a circular hair loss at the age of 16 over a whole year, after I had a lot of amalgam fillings removed and new ones made. In some cases, amalgam and gold were placed next to each other in the teeth, because some teeth were so damaged that a gold crown had to be placed. At that time, it was just not known that 2 different metals could not be used together in the mouth. In connection with this dental rehabilitation, I had a circular hair loss, as I already mentioned, which of course was a great burden on me at the age of 16 years. It also took a whole year until it got better, even with cortisone. And fortunately, after that, I never had any problems with it again. It just was such a huge psychological burden during puberty. And suddenly, during this time when I developed this chronic fatigue syndrome, my hair started to fall out again very strongly. There were larger patches, larger free areas, and it didn't really get better, not even with the cortisone therapy, which I actually only took because of the lung disease in the first place. The cortisone was then passed on, then it stabilized a bit, but the hair did not come back completely. In addition, I suddenly developed massive allergies. Hay fever, allergic asthma, a very bad hand eczema. I had a bit of allergies as a child, a bit of hay fever, but that was temporarily completely gone. But in this phase, where I was so exhausted, where I became so ill, the allergies were no longer treatable at all. I went to several allergists. They did comprehensive examinations. All allergy tests throughout the year, so pollen, grass, mugwort, celery, also the molds which play a role in the fall. All of them were positive. Also the dust mites. So a classic allergy is called type 1 allergy. Food allergies also developed very strongly cross-reactive to this pollen. That means I also couldn't tolerate spices anymore, and then I also became allergic to rice. It was very difficult with the diet because I could not eat so many things, because every time it came then to thick, swollen eyes. I woke up in the morning and suddenly I had one eye that was completely swollen shut. The hand eczema got much worse, so I had a lot of pain, even in the household when doing the housework or washing the children. Every contact with water hurt terribly. We then also discovered that I have a nickel allergy, a very strong nickel contact allergy. Nickel and chrome also cross-react, which means we exchange all the pots, exchange pans, so that there was no more nickel in the dishes. I cooked nickel-free, which means only fresh cooking, no cans whatsoever, no espresso whatsoever, no cocoa. In other words, avoided all foods with nickel in them. That had a very small effect on the hand eczema. It got a little better. I also did a zero diet for 2 weeks because I really couldn't stand it anymore. But unfortunately, it didn't heal completely even under that. That was also very, very stressful because I couldn't actually touch anything anymore. I partially cried at the checkout, simply because I sometimes could not open the wallet anymore. And in that situation, you're always in a kind of a hurry. In March 2020, the corona infection came, very early actually, which was basically not that severe. I had no fever and was actually surprised that despite the allergic asthma and the sarcoidosis, so 2 lung diseases, I was not that seriously ill. I also had shortness of breath, but the more difficult or worse thing was that I developed cardiac arrhythmia, very strong, and also a pericardial effusion with very strong pain in the heart area, which also radiated into the scapula area. That's how we came to the conclusion that it could be an effusion. After the corona infection, it went directly into a very severe long COVID, or also post-COVID syndrome, as it is called today. At that time, we didn't know that. So I had another increase in my severe exhaustion, and I had phases again and again in which I was very hoarse. About every 3 weeks, there was a situation where I had hoarseness, sore throat, headaches, flu-like feeling, night sweats. I woke up in the night drenched in sweat. So I had to strip the whole bed and always had the feeling, oh dear, now you have the infection again. But that was not the case. I even, because I didn't trust the test, ordered a PCR test every time back then because I felt so sick. The PCR was always negative. The worst thing was that since then I have had a hard time concentrating. I couldn't really describe it until much later when I was told that it was brain fog. It does actually feel similar to that, like clear thinking is no longer structured. That additionally put quite an extreme strain on me. Then, after a rampage of doctors, who were all at that time also still busy to care for the people in the pandemic, and above all was then also the lockdown. Fortunately, I then ended up with a doctor who was very competent, also in environmental medicine. I think that was the greatest luck of my life, because this woman really investigated in all the things that had played a role in my life up to that point, including amalgam, mercury, other stresses, environmental stresses, and we did a lot of blood tests. She also did a metal analysis and also a urine analysis after chelation therapy. This showed me that in the background of this severe disease, there are clear burdens from other areas of environmental medicine, and that I will probably never experience an improvement in my clinical picture if I do not also take these into account.
The patient presented to me for the first time in April 2021. She brought numerous preliminary findings, in particular, A, an examination for a genetic detoxification disorder, with which she can excrete the highly toxic heavy metals worse, and can also excrete other environmental toxins very poorly. B, a pronounced intestinal dysbiosis was conspicuous, with a leaky gut and significant deficiencies in regulatory intestinal bacteria species, which are essential for the immune defense and also for neuronal regulation.
neuronale Regulation wesentlich sind.
Anamnestic indicative was also the indication of a circular hair loss at the age of 16 years, which gives us the hint that here must be a disposition for autoimmune diseases. For the development of ME/CFS, the pre-existing immunological diseases are certainly essential. On the one hand, the reactivation of the cerebral viruses, in this case, herpes viruses, the allergy existing since childhood, the autoimmune hair loss occurring for the first time since adolescence, and the pre-existing sarcoidosis. A building block for the development of ME/CFS can also be the so-called NICOS. NICOS are chronic inflammations in the area of the roots of the teeth. They were formerly also called chronic fatty degeneration, or fatty degenerative osteomyelitis. Inflammation of the roots of the teeth can have an impact on the entire body, with a very high probability on the performance of the mitochondria. All of this contributes to entertainment of the chronic inflammatory event in ME/CFS, but also in long and post-COVID.
It was then that already under the treatment, so towards the end, the head became much clearer. I had the feeling, oh, how nice, I can think again. It was like a dawn when the fog that hovers over the water lifts. I had such a feeling in my head that I could suddenly think again. It was a completely free feeling in my head, which was wonderful after a year when I was in such a bad way. I was also able to concentrate much better as a result. The very next day after the treatment, I had the feeling, man, I have a whole new mobility and strength in my body. I then immediately tried to walk up the stairs and noticed that I felt much better. It was a bit as if everything had cleared up in my body, which was so heavy and so tired and so exhausted, like a lighter feeling in my limbs. Then we did a second apheresis after a little over a week with the same filter, and then we also had the eluates from the 2 aphereses tested. There was another marked improvement in my symptoms after the second apheresis, so much so that I thought, my goodness, this feels like the very beginning of this fatigue syndrome 17 years ago. The symptoms weren't completely gone, but every symptom had gotten significantly better. And there was so much that got better. Problems with the bladder, with breathing, with thinking, with muscles, with tendons, with exhaustion, with circulation. So I could also bend over better again, and I wasn't immediately dizzy when I got up. In the morning, I used to have to sit on the edge of the bed for half an hour before I could get up. It was a great new feeling of being alive, and it gave me courage because I thought, gosh, now I've found the way that maybe I'll get out of this exhaustion again someday, through long COVID in the end. I had not developed antibodies after corona. I had not developed T-cell immunity. So then the lab wrote back, you didn't have corona. But I did have corona because I also had a positive PCR test from the university clinic. So my body had not developed immunity to this stupid virus, and thus my doctor strongly advised me to get vaccinated. I then had myself vaccinated at the end of June 2021. This was certainly a big mistake in my particular case. After half an hour, there was a feeling in my head as if a champagne cork had hit the top of my skull, so it was like a bang in my head, and since then, I have had loud tinnitus. I then lay in bed for a week because I felt really bad with night sweats and everything that I already knew from before, feeling sick and terrible pain in the whole body. Then, so 3/4 of a year after the first pericardial effusion healed, I got another pericardial effusion and arrhythmia. It was quite terrible because when this heart pain started, I knew, oh no, here we go again. I then got thrombophlebitis 3 times in a row, that is vein inflammation. where sometimes one leg was more than 5 centimeters thicker than the other, so tissue swelling, and nobody could do anything with it. In this context, there was always acute bleeding from the bladder. That is, I sometimes had 2 days where I only had blood in my urine, or the urine looked like blood, fresh blood. Terribly painful. I luckily had a very aware, very thoughtful urologist who I was able to tell all this to. She also did a cystoscopy and said that all the mucous membrane had detached and everything looked really strange. Since then, I have had very severe pain in the sacroiliac joint. So in the sacrum, rheumatic pain in the joints. The worst thing is actually that the neurological complaints have also become much worse than just this chronic fatigue syndrome. In addition, quite severe visual disturbances have also developed. I can't read for a long time anymore, I can't look properly, and I have the feeling that I have pain in my eye, but I probably don't have that. It's probably related to the fact that I have a continuous headache since the vaccination. It keeps going. It's there every day and every night. It's a constant headache in the front of my head, in the temples, in my forehead, and it feels like it hurts like crazy behind my eyes. I first went to an ophthalmologist about it at the place where I live, and she did a mirror examination of the eyes and was quite shocked. She said, "My goodness, I've seen this now in 4 long COVID patients, quite massive vascular changes." I then went back to the cardiologist because it worried me so much, and he did an arteriography, a carotid Doppler, and also a long-term blood pressure measurement. Everything was in order. My vascular age, although I am 58 years old, is 30 to 40 years, which means that we have not found any cause for my eye vessels to look like this. But what I do have, we also had this examined, are a lot of functional autoantibodies, which means that it must be an autoimmune reaction that also has a very strong effect on the nerve tissue and also on the vessels. The hair fell out completely, which means I wear a wig. I had no more eyelashes, no more eyebrows, no more hair on my whole body. So I had 3 more Inuspheresis treatments, and I have the impression that it gets a little bit better with each treatment. Now, under the last 3 Inusphereses, the hair is coming back in some places. Some eyelashes have come back and also some eyebrows, and I am very confident that I am on the right track.
In the meantime, under chelotherapy and inuspheresis, the previously therapy-resistant hand eczema has healed. The patient also reports a considerable improvement in the circulatory disturbance of the hands under the therapy. The purpose of inuspheresis is that it is able to reduce autoimmune malformed antibodies, that it alleviates and lowers all inflammatory mediators and inflammatory factors, reduces inflammatory events in general, that it is able to reduce various viral loads, and that it can remove very many, usually the decisive environmental toxins.
We had shot the film during the Inuspheresis in October 2022, and since then I was really quite well, so that we could even go on vacation in February 2023. The stupid, unfortunate thing was that I got infected with corona there. So it was the second corona infection since March 2022. This time it was quite a severe course, which also did not want to stop at all. So that was at the beginning of February. A very heavy cough and also a tightness feeling over the chest developed, also a third pericardial effusion. I had already had a pericardial effusion during the first corona infection, then very severely after the vaccination, so this was now the 3rd time. I didn't recover at all after the infection. On the contrary, I was getting worse day by day. The cough was also getting stronger, and all the other symptoms on my body, also the pain and the circulatory problems, also the neurological bladder problems. The cough was so bad that the oxygen saturation was also reduced. So then, on March 28th, almost 7 weeks later, I decided to have another inuspheresis because I didn't know what to do therapeutically anymore. That was then very impressive because the cough already got a little better during the treatment. Afterwards, I was actually able to walk over to the train as well. About a week after the inuspheresis, the cough was completely gone. I no longer had any restriction of my lungs at all. I could breathe through again. Before, it felt like I was breathing through a coffee filter. Since then, I feel as good as I did after the last inuspheresis. Because I was very interested in what was filtered out, because I have known all along that it is a protein filter that is used in the inuspheresis. I had blood taken before the inuspheresis and 14 days after the inuspheresis. I sent this blood, as well as the eluate, to Professor Dr. Brigitte Koenig at the MMD laboratory in Magdeburg. She was so kind to offer me that she would also examine the spike protein in the eluate. In fact, before the inuspheresis, I had a spike in the immune cells of 11.5 picograms per milliliter. Afterwards, only 10, well, actually not only, the value had decreased by 1.5 picograms per milliliter. In the plasma, I still had 19.7 picograms per milliliter. For cost reasons, I foolishly neglected to have the plasma determined beforehand, which will be determined later. In the eluate, 61.15 picograms per milliliter of spike protein was found. It is not yet possible to differentiate whether it is the vaccine spike, still from the vaccination, or the spike from the new infection. We will probably be able to differentiate that in a few months. I think it is very impressive. 61.5 picograms per milliliter is quite a lot. Although, of course, you have to consider that the eluate is a concentrate that has already passed through a filter, which means it is, of course, much more concentrated than the plasma and the immune cells. But the nicest thing, of course, is that I'm doing quite well again, for which I'm very grateful. That it actually helped again. This spike detection in the eluate of the inuspheresis is, of course, very impressive for me. I had already thought so before because this is also a protein filter, but of course one cannot make a promise of a cure from this value, and secondly, one cannot draw conclusions about other patients. In my opinion, this must be investigated in larger studies from now on.